Hi, this is Dr. Ridhima again, and today I'm going to speak about refractive surgery. So refractive surgery is a procedure that helps you get rid of your spectacle number or power, and there are different kinds of laser refractive procedures. So why does one get a refractive error or spectacle power? That depends on the length and the shape of your eye. So if you are motivated that you do not want glasses or contact lenses, refractive surgery is definitely a good option for you. What criteria do you need to fulfill if you want to undergo refractive surgery? Number one, the age. You need to be at least 18, preferably 21 years of age. Number two, your refractive error or your spectacle power needs to be stable. That means there should not be more than half a diopter change in the last 1 year. And the third criterion is getting a scan or studying the shape of your cornea. The cornea is like the front layer of the eye, and we are going to reshape that with some laser to get rid of your spectacle power. So if the corneal shape and thickness is good enough and it matches your error, then you can be a candidate for refractive surgery. So there are 3-4 refractive procedures available. The first one is called surface ablation. That means we give laser directly on the top of the cornea. It's called PRK or advanced surface ablation, and it takes about like 5 minutes per eye to get it done. Just that the recovery, since we are giving laser directly on the top, it takes like about 3 to 4 days for this the surface of the eye to heal, and about a week for your vision to recover. But this is an absolutely safe procedure, especially if your error is a small error. You can opt for this one. The next and popular procedure is called LASIK. This is something that has been around for more than 2 decades, and everybody has heard of this procedure. In this, the laser is not done directly on the surface of the cornea, but a flap is made in the cornea, and the laser is given below the flap to reshape the cornea, and the flap is immediately reposited so that there's no surface wound and the recovery is rapid. Immediately the day after, you'll be able to see well. And there are 2 kinds of LASIK. One in which a machine is used to do it, and it's called a microkeratome or blade LASIK. And the second procedure is called bladeless or femtosecond laser LASIK, in which a laser will be used to mark out the flap, and another laser is used to correct the power. LASIK is a time-tested, predictable, safe procedure. The only side effect I would say is some dryness temporarily for about say 2 months or so, which can be easily tackled with some moisturizing eye drops. Contura is a kind of LASIK procedure in which it's good for people who have an irregular corneal scan, and then our treatment can match that corneal topography. So people with an irregular cornea or retreatments can opt for Contura for sure. And the last is called SMILE. So SMILE stands for small incision lenticule extraction. In SMILE, we are not making a flap or opening the eye at all. In SMILE, the femtosecond laser, which I spoke about earlier, instead of making a flap, if we use that to make a disc in the center of your cornea, and then this tiny disc is removed through a keyhole, and this lenticule or disc is then discarded. This is called SMILE procedure. So without making a flap, you are doing away with dryness, and the wound recovery is rapid. In about 3 days, water can enter your eye. The only side effect, again, I would say, is a little bit of glare for the first 2-3 weeks, but the recovery in SMILE is in about 3 to 4 days, and there's no dryness, and strength-wise, we are maintaining the structure, and your cornea tends to remain stronger as compared to the LASIK procedure. So these are all the refractive procedures available. Which one would suit you depends entirely upon the magnitude of your number and your corneal thickness and shape. If you're not eligible for any of these, there is still another procedure called phakic intraocular lens, or commonly called as ICL, in which we do not, if your cornea is quite thin or your number is very high, then you may be a candidate for phakic IOL implantation. That is also an extremely simple procedure with very rewarding results. It can be used to correct spectacle power up to almost 30 diopters, and it's an extra additional lens that is implanted in front of the natural lens of your eye. So these are all the possible procedures available. I think the recovery and the eye drops and the side effects I will discuss in more detail in the next video. If you have any questions, please type them in the comments below and I'll be happy to answer. Thank you.